Basic anatomy. Application of basic anatomy. Basic anatomy is the basis for understanding pathology, physiology, and clinical skills. Anatomical knowledge is used in procedures such as surgery, disease diagnosis, and therapy. By studying basic anatomy, medical students can understand the structure of the human body as a whole as a foundation for clinical medical education. Of course, the discussion of basic anatomy can be expanded in more depth by adding the following elements: the application of basic anatomy in the fields of medicine, health sciences, and biology is very important because basic anatomy provides a foundation for understanding the structure of the human body that can be used in various fields of medical practice, research, and therapy development. This application includes the use of anatomical knowledge in diagnosis, patient care, medical procedures, and the development of medical technology. The following is a detailed explanation of the various applications of basic anatomy in the lives of medical professionals and beyond. 1. Application of basic anatomy in medical education. Medical education utilizes basic anatomy to provide medical students with an understanding of the structure of the human body, which is essential for the process of diagnosis, treatment, and surgery. A. Basic understanding for diagnosis and examination. Physical examination. Basic anatomy helps doctors and medical personnel perform physical examinations. By understanding the structure of the body in detail, they can feel or examine certain body parts to detect abnormalities. For example, checking for swelling, lumps, or stiffness in muscles, connective tissues or organs. Clinical anatomical examination. Techniques such as palpation, feeling, auscultation, listening to organ sounds, and percussion, striking the body surface, all rely on a thorough knowledge of anatomy to identify medical conditions. B. Simulation and practical learning. Dissection and 3D models. Anatomy learning is often done using the human body or a 3D body model. Medical students learn to identify different body structures and organs through body dissection or body model to understand macroscopic anatomy. In addition, computer-based 3D models and virtual reality (VR) technology are increasingly being used to replace or complement direct dissection. Diagnosis. Understanding the structure of the human body is helpful in identifying the symptoms of certain diseases, as well as guiding physicians to make a more accurate diagnosis based on symptoms and physical findings. 2. Application of basic anatomy in surgery and dissection. Basic anatomy is the foundation for surgeons in performing various medical and surgical procedures. Without a solid understanding of anatomy, surgical procedures can be very risky. A. Surgical planning. Avoiding organ and blood vessel damage, In surgical procedures, basic anatomy is used to understand the location of important organs and blood vessels in the body. This allows the surgeon to avoid damage to vital body structures, such as major arteries, nerves, and other important organs. Determining a safe surgical path. In many surgeries, the anatomy of the body must be thoroughly understood in order to choose a surgical path or technique that minimizes risk and patient recovery time. B. Use of minimally invasive surgical techniques. Laparoscopy. Laparoscopic techniques, or minimally invasive surgery, allow surgeons to perform procedures using small instruments and cameras through small incisions. Knowledge of basic anatomy is essential in this technique, as surgeons must know the exact location of organs and body structures to avoid unnecessary tissue injury. Robotic surgery. The use of robots in surgery also requires an understanding of anatomy to direct the robot in the surgical procedure. Robotic systems are equipped with 3D images of the human body that allow surgeons to see the patient's anatomy in great detail. 3. Application of basic anatomy in diagnostics and imaging. Medical imaging techniques use an understanding of basic anatomy to help diagnose diseases or medical conditions. The images produced by various imaging techniques are used by doctors to examine and visualize body structures. A. Medical imaging, radiology, X-rays and CT scans. Knowledge of anatomy is necessary to interpret the results of X-rays and CT scans. Doctors must know the normal body structure to be able to distinguish between healthy and abnormal structures, such as detecting fractures, tumors, or damage to organs. MRI. Other imaging techniques such as MRI require a deep understanding of human anatomy to recognize changes that may occur in soft tissues, such as the brain, heart, and muscles. B. Ultrasonography, USG, pregnancy detection. Basic anatomy is very important in monitoring fetal development during pregnancy using ultrasound. Knowledge of the structure of the mother and fetus helps in checking a healthy pregnancy and detecting abnormalities. Internal organ examination. Ultrasound is used to examine organs such as the liver, kidneys, and pancreas. Using anatomical principles, doctors can visualize these organs in images to detect abnormalities. 4. Application of basic anatomy in physical medicine and rehabilitation. Knowledge of basic anatomy is very useful in physical medicine and rehabilitation to design therapy programs that can improve the health and mobility of patients. A. Injury healing. Understanding muscles and joints. Physical therapy requires an understanding of muscles, ligaments, and other body structures to design exercises that can reduce pain, increase flexibility, and speed recovery after an injury. For example, A physical therapist can use knowledge of anatomy to design movements that aim to improve joint mobility or strengthen weak muscles. B. Assistive device fitting procedures, prosthetics and orthotics. Prosthetic use. Fitting a prosthetic or artificial limb requires an understanding of basic anatomy. The design and fitting of a prosthetic, such as an artificial hand or leg, must take into account the patient's anatomy to ensure optimal comfort and functionality. Artificial muscles and joints. Orthotics or splints are used to help support an injured body part, taking into account the anatomical relationships between bones, muscles, and joints to facilitate the healing process. 5. Application of basic anatomy in physiology and other health sciences. Basic anatomy is essential in understanding how body structures function, which is essential in other health sciences such as physiology, pharmacy, and nutrition. A. Physiology, organ and system function. Physiology is the study of how the organs and systems of the body work. Knowledge of anatomy allows for an understanding of how body structures function in a larger context. For example, an understanding of the structure of the heart, blood vessels, and respiratory system is essential in learning how the body regulates blood and oxygen circulation. B. Nutrition and pharmacy. Drug dosage and distribution. Knowledge of body anatomy is also essential in pharmacy, particularly in understanding how drugs work in the body. This involves an understanding of blood circulation, digestion, and the distribution of drugs to the proper organs of the body. Food and nutrition. An understanding of anatomy is also used in nutrition to ensure that the body's organs can digest and absorb food effectively. Knowing the structure of the body also helps in designing a diet that can support overall body health. Conclusion. The application of basic anatomy is essential in various medical and scientific fields. From medical diagnosis, surgical procedures, to medical imaging. Understanding the structure of the human body allows medical professionals to provide better and more effective care. In addition, anatomy also plays a vital role in physical medicine, rehabilitation, and the development of medical technology. In other words, basic anatomy is an indispensable foundation in various health disciplines, leading to improved quality of care and patient safety.